90% plus of erectile dysfunction is vasculogenic, so related to vascular flow.
Dr. Judd Brandeis, the 21st century man.
Absolutely.
I am so glad to finally connect with you. It was going to be last month, and I was about to get in my car and drive for this beautiful experiential day here, and I didn't feel right, so I turned around, canceled on everybody. It turns out I had COVID, so now I come back healthy and strong.
Stronger, better.
This guy put me to the test today, so he's going to be doing a lot of the talking because I just finished a VO2 max test, and that will allow us to segue into all the incredible things that you do at the Brandeis MD clinic here in beautiful San Ramon, California. But I guess we should start by saying, how did you get into this amazing cutting-edge game of helping with male sexual wellness and then spilling into all types of peak performance endeavors?
Yeah, I mean, I've always been interested in new stuff and always being on the cutting edge of medicine. So when I started my urology career in Walnut Creek up the street, I was one of the first people in the country to do surgical robotics. So removing the prostate using a robot. I started a kidney stone center. I started an MRI-guided prostate biopsy. And about 5 years ago, I heard about GainsWave as this amazing technology to help regenerate or restore erectile function for men. And I became really intrigued. I went to Miami. I got trained at GainsWave and started doing the GainsWave low-intensity shockwave therapy on men and discovered that, lo and behold, men who previously were unable to get erections now could get erections. And then I started building on that, right? Because you can't view sexual function unto itself, right? You have to take care of hormonal function. You have to take care of overall physical function, right? So if you're a 73-year-old type 2 diabetic and you're 40 pounds overweight and you have GainsWave, it'll work for a couple months. But if you don't lose weight, if you don't get in shape, if you don't replace testosterone, a couple months later, you're going to be no better off than you were when you started. So then I developed really this holistic approach to men's health, right? So look better, feel better, have better physical intimacy.
So the entry point of coming to you for sexual dysfunction, what are the major causes of this? We hear it's a huge problem right now.
Yeah.
And I've heard things about how it's a lot of psychological. Some people have that blood flow problem that you treat with the GainsWave treatment. But when you're talking about a holistic approach, what are the big picture items?
I mean, the thing is, the reason guys come here is because of their penis. Guys will always
go anywhere.
Penis, right? I get these wives say, I've been trying to get him come in for such a long time to lose weight, to start exercising, do this, do that. And then when things failed in bed, he figured things are bad enough that I need to do something about it, right? And 90% plus of erectile dysfunction is vasculogenic, so related to vascular flow. Some of it is neurogenic, so related to nerves. So, end-stage diabetes, guys that have prostate operations, people that have strokes or multiple sclerosis or those things. But a preponderance of men have vasculogenic. Some people have hormonal issues, if your testosterone's super low. Some people have psychogenic issues, phobias, anxiety, et cetera, trauma. I mean, there are a number of causes, but 90% plus are related to a decrease in blood flow to the penis. And that's what we're trying to address.
And how do the drugs line up with your treatments?
The PDE5 inhibitors like Viagra and Cialis. Yeah, I mean, those are miracle drugs. I mean, they're really incredible. Like the literature that's coming out on Cialis now and Viagra, first of all, they improve erections. Second of all, Cialis has an indication for improving urinary function. Third of all, they've been shown to decrease the risk of dementia. And fourth of all, they've been shown to decrease the risk of heart disease. So these are incredibly effective, really super safe drugs. And I put a lot of my patients on them because the thing is, the way that you need to think about erectile function is there's the signal and then there's the pipes, right? So the signal actually comes from a molecule called nitric oxide.
So I thought you were going to say it comes from the girlfriend.
Well, yeah. I mean, that's the beginning. You should read that chapter in my book called Sex on the Beach. And it actually goes, it's kind of like two parallel stories, right? It's like a girl meets guy story, and then there's a subtext of what's actually going on physiologically. Right?
Fun.
So yeah,
Like a novel.
and like a novel, yeah,
Just a little break from all the academic stuff in there.
exactly. And so so girl meets guy, and nerves fire, and they release nitric oxide. Right, and nitric oxide is the same nitric oxide that a lot of elite endurance athletes will take as a booster, or people take for cognition, or people will take for blood pressure. It non-specifically boosts circulation, right? And so you'll get better genital circulation. And then nitric oxide boosts something called cyclic GMP, right? And I'm not going to quiz you on what cyclic GMP is, but it's kind of the linchpin of the whole system. And the PDE enzyme breaks down cyclic GMP. So the more cyclic GMP you have, the more blood vessels open. When you have PDE, it breaks down cyclic GMP and blood vessels close. Now, the genius discovery that Pfizer made was when they were testing this drug, some astute nurse noticed that all of the patients that had taken sildenafil were lying on their belly. And they're like, why are you lying on your belly? And they're like, well, we're got a good erection. And so that's actually how they discovered that Viagra had that effect. And then actually some of my professors at UCLA wrote the original papers on how Viagra works. And it works because there's an enzyme called PDE5. And PDE5 is only in the penis. And if you selectively block PDE5, then you selectively shunt blood to the penis. So you need a nitric oxide booster. And I make a nitric oxide booster called Affirm.
So you have a supplement.
A supplement. Yeah. So this is basically watermelon and beets, or citrulline and beet extract. And that boosts blood flow and boosts cyclic GMP. And then if you take a PDE5 inhibitor, it blocks the breakdown of cyclic GMP, and that keeps blood vessels open. But that's the signal, right? So say you're 70 and you're a diabetic and you smoke and your blood vessels are crap, they're all clogged up. It doesn't matter if you're boosting the signal. You don't have the flow to get to the penis. And that's where Gainswave comes in. That's where PRP, that's where a number of the other treatment modalities that we use. And so what Gainswave is either low-intensity shockwave therapy or radial pulse therapy. And what that does is it's applied to the penis, and it tricks the body into thinking that there's an injury. Even though there's no injury, it tricks the body into thinking that there's an injury, and you get an injury response. And that injury response is an inflammatory response. And that inflammatory response in this situation helps grow blood vessels because it's a healing response, right? Everyone thinks inflammation's bad. Chronic inflammation is bad. Acute inflammation is good, right? That's what we use to heal. That's what we use to rebuild tissue. That's what we use to fight bacteria and viruses and keep invaders out. And we're taking advantage of that acute inflammatory response to stimulate the body to grow new blood vessels.
So it tricks the body to thinking that it's been injured.
Right.
But when I had the treatment on my penis earlier this morning, it was amazing because it was absolutely painless, but you could sense there was a lot of shockwave going on. And then you moved over and you said, let me know if you get too close to my bone because it's going to hurt. And it hurt like heck.
Yeah.
The difference between going right into the penis versus hitting a bone was amazing. So you could describe the shock waves are getting dissipated, but when they hit the bone, you feel it.
Yeah, I mean, so these shock waves are basically like high intensity sound waves, and that energy courses through water, right? Like sonar, right? And when it hits something, you get a ping back. Ping. So when it hit the bone, you got a ping, and it hit the periosteum,
right,
and you got a ping,
right?
To the nerves. But that's really how it works. Is it stimulates the vascular tissue in the penis to undergo neoangiogenesis, or the growth of new blood vessels.
So it would be quite different. I was just thinking humorously maybe of, oh, hey, let's try this at home with my Theragun massage gun, and bash up my penis and get the same response, but it's something entirely different.
It's a different waveform.
It is. So come to the clinic is
come to the
what we're talking about.
It's just like what the shockwave I did to your glute.
Yeah.
Right. You can use a one of those hyper ice or whatever those things are. Yeah. Right. And those are more like fancy massagers. The shockwave has a very high peak and a very sharp drop. It's a very specific wave pattern that will cause a very specific physiologic reaction in the body.
Oh, I've never felt anything like it. It was amazing. Yeah. I mean, it was somewhat painful, but you could tell something was going on there that had never been with any other treatment modality, whether it's an elbow from the massage therapist or the heavy use of the gun or even the TENS units with the electrical stim. So it seemed like it was getting down and doing some major work. So if someone's interested in getting a gains wave therapy, you're talking about coming here for a series of treatments to continue to stimulate this injury positive inflammatory response.
Yeah, I mean, you have to individualize treatment. And so, like I said, you have to treat the signal, and we treat the signal with the Affirm nitric oxide booster with PDE5 inhibitors. And then you have to build blood vessels, right? And we build blood vessels with GainsWave. We also use PRP injections to stimulate the growth of new blood vessels. We also even use Botox, right? Because Botox will relax blood vessels, allow the blood vessels to open. So we have, I just wrote an article in Muscle and Fitness called Urologist's Guide to Sexual Superpowers. And there are, I think, 12 or 13 different things that we do in the office that go beyond the little blue pill.
Right. That's well described, where maybe you're getting all the intended benefits of the prescription medication, but it's not happening for you due to these. I imagine there's a lot of lifestyle intervention too, where you're mentioning eating and exercise.
Yeah, I mean, that's the really important thing to consider is that in life, when you lose nighttime erections, you've lost a percentage of your circulation to the penis, right? So every night when you go to sleep, you're supposed to get 30 to 60 minutes of erections, right? Every time you hit REM sleep, where you start to dream, you should be getting an erection. And that's way your body takes care of the penis. It keeps it healthy, right? But if you lose nighttime erections, about 10 years later, during intercourse, things are going to fail for you.
10 years
about
later?
10 years, right? So you got a 10-year head start.
Wow.
On exercising, eating better, stop smoking, don't drink so much, get your cholesterol under control, de-stress yourself, all the things we talk about in the 21st Century Man book. Now, 10 years after you have a fail in bed, it's very likely that you're going to have some sort of cardiovascular event or a heart attack or a stroke or an angioplasty or something, right? Because the arteries to the penis are 1 or 2 millimeters and they're peripheral. The arteries to the heart are 3 to 4 millimeters and they're central. So what's going to fail first? Penis.
So you're going to get early warning signs. How come we don't hear about this as a prominent national public health? The boner patrol is going to prevent heart disease.
It really, this is like science. This is like tried and true. And that's why I really don't like the Blue Chews and the Hims and the Roman and all these services that just send Viagra and let's out men, because you're missing a really, really important point where you can intervene in someone's life and say, listen, the reason you're getting erectile function or dysfunction is that your blood vessels are getting clogged. And if you don't do something about it, in 10 years, you're going to have a heart attack or you're going to have a stroke.
So the drugs are assisting clogged blood vessels perform a little better, but we're not really addressing the cause.
Exactly.
And with, for example, a GainsWave treatment, now you are kind of addressing the cause because you're creating that micro trauma and that inflammatory response that's taking care of those blood vessels, but then we're zooming out again. So I guess that's leads me to my question of how you got going on this gigantic book. If you're watching on YouTube, it is thicker and heavier than Ben Greenfield's book, Boundless, which is the highest form of compliment you can give to any author. So I suppose you were, I know a lot of physicians in this point where you're working hard all day, cleaning pipes or whatever you're doing, and then going home and saying, okay, Maybe how could I get to the point where my patients don't need these interventions as much or can complement?
Yeah. Well, this was my COVID project.
Oh, nice.
It lasted a lot longer than COVID, but yeah, they closed down for 3 months.
Yeah.
And so I'm one of the
Boy, you must have had some desperate clients going, hey, I'm in trouble, man. Can you meet me at my house with a mask and your little magic wand? Oh, my goodness. Okay, closed down. So he went home and started cranking.
Yeah. And, men need help. Men live, 100 years ago, men lived 1 year less than women. Now men live 5 years less than women in 100 years. And men are half as likely to go to the doctor as women. Right? So men need help. And so this book, really, it's not just me, but 60 of my men's health colleagues, cardiologists, orthopedists, urologists, physical therapists, psychologists, you name it. Every aspect of men's health is baked into this book because I have guys that come into the office with a huge variety of problems that end up causing their erectile dysfunction, and that each one of them deserved a chapter. Even things like mindfulness and
dedicated to this person, that person. Love it. Yeah. Mindfulness, yoga.
Yeah. I mean, I can even see like in my own mind, like, oh yeah, I remember when that guy came in, we needed a chapter on stretching. When that guy came in, we needed a chapter on sleep.
And how's the project been received?
Oh, it's been great. I mean, it's hard to sell books these days, as I'm sure you know. But anyone that's gotten the book, read the book, really felt like it was life-changing for them.
You also do a great job with those videos. So people who just want to get a basic feel for what's going on, the video's 4 minutes long, but you explained everything in detail. And I think on the show too, we're getting a good understanding of how these pieces fit together, especially that part about ordering up your pill that gives you, an instant improvement, but we're looking down the line with those 10-year checkpoints. So again, 10 years, losing the nighttime erections, guess what? 10 years, you're going to have a problem in the bedroom. And then 10 more years, you're going to have a cardiovascular problem.
Yeah. I mean, I save people's lives not infrequently here because someone will come in, they have a family history of heart disease, people in their family died at early ages of heart disease. They'll come in with erectile dysfunction and I'll make them promise that they get a heart calcium score, which is just basically a CT scan of their heart. And lo and behold, they get all this calcium sitting in the heart and they need some sort of intervention, whether it's a statin or aspirin or angiogram or angioplasty or, even some of my patients have had heart surgeries that walked in totally asymptomatic. Everything's fine. They look normal, but you never really know what's going on under the hood until you look.
So we did so much stuff this morning, my head's spinning, but thinking back now, one of the things was the ultrasound right on to the penis, which will be posted on Instagram. We took a video and showing the screen, and you showed me the artery, the very tiny looking artery, or a couple of them on each side, and those look clear, but I'm assuming that sometimes you see a person with a problem on those peripheral arteries, and that's a huge red flag.
Absolutely. So, I mean, I've ultrasounded, hundreds and hundreds of men, old men, young men, potent men, impotent men, and I can very easily tell. There's not really a scale for a flaccid penis for a number of reasons, but I've seen enough where I can kind of look at it and say, this guy's not going to have a problem or this guy's going to have a problem. The lumen of the blood vessel is small, the wall is thick, you got some problems.
And then you're going to refer them out to cardiovascular.
Yeah, I mean, I have cardiologists that I send out to, or vascular surgeons that I refer people out to, or I just refer them out for testing to see if they actually need a referral. But, I see men's health through the lens of the penis.
That's a great quote. I mean, there's our headline caption.
Yeah.
Right. And that brings up a really important point, which is men need help. Men are less likely to get help, maybe because of the tough guy, the macho mentality. But I think also when it comes to this area of sexual wellness, there's probably a cultural, baseline of being uncomfortable talking about it, even with your buddies. And I imagine somehow the people that get through your door have overcome that to call and make the appointment from the friendly staff.
Yeah, I mean, there's a lot of trepidation. I mean, that's why we set the office up the way that we do.
Oh, you should see it. It's incredible. It's like a clubhouse, really.
You know, we play all sorts of cool music, and because there's a lot of anxiety and shame and humiliation coming in to an office where you're going to talk about the fact that you can't get a good erection anymore, because that's so central to like a guy's sense of self, their sense of power, their sense of manliness. And when you lose that, it's really devastating to guys. I mean, I've had guys that don't even have partners that want to get their erections back just because they want to wake up with their morning friend, right? You know, it's like, it's just like a check-in, like things are okay. And it's that important to guys. And so we really make sure that we treat our patients with respect and really honor the fact that they're here. And it's really amazing how we can turn people's lives around. You know, and it's, I think I've done enough in enough different aspects of medicine, in urology, in physical fitness, in, you know, I've done my own therapy and all that kind of stuff. So I know enough to be able to look a guy in the face and say, you know, dude, what the fuck are you doing?
Right.
You know, you're driving yourself into the ground.
Yeah.
You know, or if they need a different approach, you know, I approach them differently. But, you know, I'll talk to people that are CEOs or, you know, big time attorneys, whatever, that don't have people talk to them in those respects and say, you know, you're 40 pounds overweight, you're out of shape. You know, what are you working so hard for?
Yeah.
You know, you need to take care of yourself.
Yeah, that's great. Yeah. I mean, it doesn't hurt to have a wake-up call. And I think it's so easy today to just get distracted with the overwhelming amount of stimulation in life and not really realize what course you're charting on until someone calls you out. And I've had those checkpoints in my life where people, you know, stood up to me and said, like, hey, Brad, why are you still racing triathlons? You stink. You were great a few years ago. I remember when you kicked all those guys' ass and now you're 7th and you think it's okay. And I'm like, yeah, well, I might get better next week. But this was a guy who helped me retire from the thing that I loved and I was completely consumed by for a decade. And he was absolutely right. And of all my wonderful supporters and family and friends who said, you can do it, Brad. One guy said, I had an Australian accent, Peter, so I'm going to use the Australian accent. Kearns, you suck now, mate. You should fucking quit. And it was just the most incredible gift. And I thank him, you know, and he meant it. He wasn't, you know, playing a game with me.
Yeah.
He just said, you stink and you should move on. Get a fucking job, mate.
Yeah.
Do something else, you know. And I can get that vibe from you where you got someone in who's on top of the world in so many ways. And they can't get
the body
composition. Talk.
The body composition scan really.
Oh yeah. We got to cover all those things. That was
you know, like if the scan says, yeah, I see a lot of guys that say, you know, you have a beach body. What do you mean beach body? They got strong arms, strong upper body,
spare
weak abs, no legs.
Oh boy.
And they're carrying, you know, 40 pounds of extra weight.
Yeah.
And I tell them, you know, like what happens if you build a building that's top heavy and has a weak foundation? Falls, right?
Yeah.
So what happens when you fall? You break a hip.
Oh.
And 50% of people that break hips are dead in 5 years.
Yeah, that's rough.
Those are just numbers.
Yeah.
Right? I mean, so that's a wake-up call. Like, or I tell them, you know, like, listen, you got weak legs. You got chicken legs. You're not going to be able to get upstairs. You're not going to be able to travel. You're not going to be able to play with the grandkids. So you worked so hard to accumulate enough money to enjoy your retirement. You're not going to be able to enjoy your retirement because you're going to be sitting on the couch.
Yeah. And I imagine also, like, I'm here out of tremendous interest for what you're doing. And of course, I would love to be better on every category of my life, including my sexual wellness, but I wasn't coming in here desperate and dysfunctional. But I imagine everybody over 40, as it says on the book cover, could probably get some improvement, mild to significant to tremendous, from going through the protocols.
Yeah, I mean, the thing is, in your 20s and 30s, you can compensate for stuff, right? You have enough reserve. Most people have enough reserve that you can go all night drinking or partying or whatever, and the next day show up from work and get through work. Right? But at a certain point, you just can't do that anymore, right? You kind of run out of that extra powers that you have.
Yeah.
But the problem is, if you don't take good care of yourself in your 20s and 30s and 40s, in the 50s and 60s and 70s, you're going to pay the price.
Yeah.
Right? You want your 65-year-old self to say, damn, thank you so much for taking good care of me, because at 65, I can still exercise, I can still be physically intimate, I can still travel, I can still do all the things that I enjoy doing. You don't want your 65-year-old self to say, what the hell were you idiot? You idiot. You were eating donuts and McDonald's, you were drinking, you were smoking, you were partying, you weren't getting enough sleep. And, now I can't have sex, I can't travel, I can't, my leg's about to be amputated because I'm a diabetic. You don't want to have that discussion with your 30-year-old self.
Yeah, I mean, the effects of stress are cumulative. Jay Feldman made a great point on my podcast interview where we're jumping into the cold tub, we're doing a crushing CrossFit workout, we're, cranking away at work and going from 40 hours to 47 to 53 to 60 so we could get it all done and crush life. And maybe you did get away with it in whatever year it is, 2023, but we are looking down in the future, and hopefully people of all age groups are listening. I think it's never too late, even if you're 50, 60, 70. But if you're 27 listening to this podcast, oh my goodness, it's time to take corrective action.
Oh, yeah.
And I'm reflecting on my fascination with high jumping, and I used to jump out of the stands after the middle school track meet was over and run out onto the track and take some jumps because the pit was still there before they cleaned it up. There's no warm-up. There was no pain. I might have done it in bare feet. Nothing mattered because I was still resilient at age 40. And now it takes me 40 minutes to warm up to take my first approach because everything's needing that much more TLC. And I probably abused it back then,
I think one of the most important slides that I show my patients is the world record for the 100-yard freestyle in swimming. But you can do the same thing for the 100-yard dash or whatever. And the decline in times is pretty subtle until you get to about 60 by age group.
Yeah.
After 60, the slope shoots up.
60.
And after 80, the slope really accelerates, right? And so there's something about the age of 60 that even if you're doing things right, things begin to fall apart. And I was running the other day, I ran 3 miles at about an 8 minute per mile pace.
He's an old-time runner, people.
Yeah.
He's got Roger Bannister up on the wall. Collegiate runner here.
8 minute per mile is
It's not bad, actually.
pathetic.
Yeah, I mean,
Right.
me and you might talk about how it's pathetic from looking back to when we were jogging 6 minute miles, but it's actually quite impressive. Yeah.
But my heart rate was 155
Yeah.
at the peak, right? So I'm at 94% of my max heart rate running 8 minutes per mile.
Yeah. Huffing and puffing.
Right?
Yeah.
My son's running 5:30s, and his heart rate's it's higher because he's younger, but, so it's, I'm beginning to get to that point where it doesn't matter how much harder I work, I'm going to see that decline.
Yeah.
Which is sad.
Yeah. I mean, I think especially with explosive things where it's difficult to maintain that type of high-intensity fitness.
Fast twitch muscles go a lot quicker than slow twitch muscles.
And it's to get good at sprinting, you're talking about a high trauma, high impact exercise that you can't go do 4 days a week like your son on high school track teams. So we have to kind of work around these problems.
But, that's part of the reason that I do a lot of the things I do. Like, for example, testosterone replacement can have a dramatic effect on improving muscle mass and physical performance, mental performance, sexual performance. And then the other thing is the M-sculpt.
Oh, yes. We forgot to talk about that.
Yeah.
Another thing I went through. Before we get to the M-sculpt, the first thing I did was step on the scale. And it was such an amazing, I'm totally out of the high-tech scene. It's been so long. But I stepped on the scale and I calculated my lean body mass, my body fat percentage, and also the symmetry.
Right arm, left leg, right leg, and trunk.
And that was the muscle mass percentage, the balance. And so you're looking at people.
Yeah, I mean, it calculates the total weight. Yeah. But then it puts it on a norm based on your height and weight.
Right. You get a report, boom, it takes 1 minute. And in the old days, we had to go into a water tank and blow the air out of our lungs to get our body fat.
It runs electrical microcurrent through your body, and muscle transmits microcurrent faster than through fat.
Mm-hmm.
And so by some whatever crazy algorithm that these engineers put together, they're 99% correlated with like a DEXA scan.
So we talked about the Gainswave treatment, the ultrasound to examine the arteries and the arterial health of my penis, and then we went to the M-Sculpt. And let's talk about what this new high-tech...
Yeah, this is like one of my favorite machines there.
EMSCULPT is the machine.
And it's made by a company called BTL, which is a huge medical technology company out of Czechoslovakia. And pretty much any Hollywood movie star that you see that has six-pack abs is now doing M-Sculpt. And even some of the professional athletes are starting to discover it. But really, for me, it's ideal for men over the age of 50 when you enter what's called the sarcopenic phase of life. So you begin to lose muscle, right? No matter what you do, you're losing muscle. Your testosterone's going down. Your level of activity goes down. You don't absorb protein as well. You don't sleep as well. You don't hydrate as well. All the things, your nerves don't work as well. All the things that used to work really well don't work the way that they used to work. And so M-Sculpt uses high-intensity focused electromagnetic waves. So it's not one of these cheap TENS units you'll see on late-night TV.
Mm-hmm.
Those are direct current. This is alternating electromagnetic fields with a 2 Tesla magnet, and you can set the depth of penetration to the muscle belly. So you get, I'm sure you experienced a full muscle contraction.
Yeah, it's a device. It's like bigger than a handheld, but it straps on to the targeted muscle group. Then you turn the machine on, and what I'm feeling is a very intense muscle contraction, not painful, but it's like doing crunches in the case of putting it on my abs.
Yeah, and it's purely isolating the muscle. So I see a lot of guys with back issues, spine issues, and it works amazingly for them because they need muscle strength for their core. And they can't do sit-ups, they can't do crunches because it hurts their back, but they actually can. I have a guy that used to come in, he was the CEO of this really cool company out of Silicon Valley, and he would come in once a week, and he was getting epidurals like once a month. And after, I think, 6 or 8 treatments, he didn't need epidurals anymore. He was able to build the core strength to support the spine so that he wasn't compressing discs.
Wow.
And so for my spine patients, I usually recommend glutes and abs, so you support the anterior and posterior core.
Yeah. So, I mean, it's presented as a workout, but I was also thinking how valuable it would be as kind of a post-exercise protocol to help clear the waste products out and just get increased blood flow and set you up for a nice recovery period.
Yeah, I've never really used it that way. You probably could, but it's, the micro tears that it creates in the muscle are very significantly greater than you could do in the gym, right? So the reason is, you ever hear those stories where like someone gets trapped under a boulder and they're able to summon some superhuman strength to push the boulder off and escape? You ever wonder why that actually happens? Right? You have a circuit breaker in your brain that says that you can only use a muscle to a certain extent.
Right.
Because if you overuse the muscle, then you tear the ligament off the bone or the tendon off the bone, and then you're toast, right? So the squirrels out there, if they tear a ligament or a tendon off a bone, they're dead. Right? They can't climb trees. They can't go get nuts. They can't escape from the hawks, right? So there's a circuit breaker in the brain that says you can only stress the muscle so much. But if you're in a situation that's totally life or death, you're able to summon enough adrenaline that overrides that circuit breaker, and you can shove the boulder off you. Or I had a friend that actually got trapped under a Jeep because he parked it on a hill and it rolled on top of him on his chest, and his wife, 115-pound wife, came out and lifted the Jeep off of her husband's chest so he could roll out and save his life. Right? True story. So there's a limit to how much you can stress them on.
Yeah.
But with the M-Sculpt, you can turn it up as much as you want. You got to 50%, I could probably have gotten up to 60%. But if I had gotten you to 70 or 80%, I would have ripped
James Bond movie.
No, I would have ripped the muscle off the bone.
Wow.
Right?
The power you hold on that console.
I mean, you turn it up as much as as you want.
Yeah.
It's not there's not a limitation in terms of how you can stress the muscle. There's a limitation on the muscle. So if the muscle is not strong enough to pull the tendon off the bone, but some muscles are, so especially the rectus muscles, right? So, that's why you got to be really careful, but that's also why you build muscle much faster with M-Sculpt than you would in the gym, because you get full muscle contraction. You're there for half an hour. You drive out the lactic acid so you don't get any soreness. And I usually recommend about 3-4 days of recovery after one of those.
Wow. Your description is really amazing. It makes me think of Dr. Timothy Noakes' central governor theory. This is actually true, that the brain is the limiter of performance, not the muscle. And your friend lifting the Jeep is a great example. Like, we can go way farther than we think, but there's a really good reason for protecting us. So when I was doing my VO2 max test, which we'll talk about, I probably could have gone another segment of wattage if you had a gun to my head, for example. I certainly could have, and I'd still be in there.
Well, I mean, that's the beauty of VO2 max, right? Is there's a point where you actually can't, right? And that's VO2 max.
Oh, right.
Right. So think about it this way. Like, you're walking, you use 1 liter of oxygen a minute.
Yeah.
Then you're jogging, you use 2 liters. You're running, you use 3 liters. You're sprinting, you use 4 liters. Then a bear jumps out behind a tree and you take off at a dead sprint. Maybe you get to 5 liters, and then the whole bear family runs after you. And you're running even faster. Maybe you get up to 5.1, but that's it.
Right.
And then you don't have enough oxygen to match up with the glucose. And so you start anaerobically burning glucose into lactic acid and pyruvic acid, and you only get 2 ATPs instead of 36 ATPs. So you start to build up lactic acid that burns in your leg, and you don't have enough ATP to keep going. So, you had beautiful curves in your study. You should post those on your site, where you can see all of a sudden your PO2 was going up and up and up, and then all of a sudden it started to go down. And I looked at Kat, my nurse, and I said, "This guy's cooked." And 5 seconds later, usually people finish the protocol. Well, I mean, you did really well. You kind of actually had one of the highest. I do a lot of firemen, so we get some pretty high VO2 maxes. I do testing on firemen, but because they're low oxygen athletes.
Oh, sure, right.
Especially wilderness firefighters. They have to be able to perform under low oxygen conditions.
Yeah.
But I think you were definitely up there with them.
Patrick McCune, author of The Oxygen Advantage, he talks about how many elite athletes are overbreathers because they're accustomed to just sucking in a lot of air that they don't need, and they have poor carbon dioxide tolerance. It's fascinating. So I've been working on nasal breathing when I'm pedaling at a comfortable rate and trying to get better with, minimize oxygen consumption, better carbon dioxide tolerance. But for the VO2 max test, I should have set it up a little better. But you got this cool thing in your clinic. You said you got it for the fun factor, but now it's being really highly regarded as a metric for fitness and for aging gracefully. So maybe you could describe what the machine does and what it's measuring.
Well, so I was talking to the fire chief, and he said, "Oh, well, I get a stress test every year."
Mm-hmm.
And I said, "That's the most useless test for someone like you."
Oh,
right. It's good if it's good for grandpa.
You're talking about the treadmill test at the cardiologist office, where you're breathing through.
Basically, what you see when you do a stress test is there the chance of ischemia, right? Is there a chance that the blood flow and the oxygen is not getting to the heart muscle, right? And if that happens, then the electrical axis of the heart changes. And if you see those changes, then you're like, maybe there's some blockage in blood vessels. Right. But, for a 30, 40, 50-year-old guy, it's not going to show anything.
Right.
Right. I mean, I think my personal opinion is so many stress tests are done really with no benefit. But you get a test like VO2 max, you get a number. That number gives you, we'll send you your test results. It gives you a physiologic age. Right. So you may be 60, but your cardiovascular system is 55. When I did my test, I think it was 55. My cardiovascular age was 47. Right. So it gives you a real indicator. I have a patient who was 38, and it said his cardiovascular age was 42. Right? He's coming in next week, and I'm going to have a talk with him. Right? Because the thing is,
it's good. Try to get that down to 38. How about
that? I mean, guys respond to numbers.
Yeah.
Right? Yeah. If I show someone their in-body and say, listen, you got 40 pounds of fat you got to get rid of, or your legs are weak, you got to get them stronger. Like, what are you going to argue with me? Argue with this.
Yeah, right.
Right. And make an intervention and then come back in 3 months and let's see if the needle moves. VO2 max, same thing. It gives you it is the single most sensitive indicator of someone's cardiovascular fitness. Right. Like if you wanted to give me any one piece of data that would help me understand how someone was going to live from a cardiovascular standpoint, VO2 max by far and away would be the best. And it also gives you an opportunity to improve it. And the way you improve it is through high intensity interval training, right? Because when you do HIIT training, you get your heart rate up to the max, right? To your lactic acid threshold, hold it for as long as you can, and then drop it down. And so you're training your body to push that VO2 max higher and higher.
So this is the volume of oxygen that you can consume, that you can process in your body per kilogram of body weight. So it's a function of body weight. That's why if you're 40 pounds overweight, you're going to have a shitty VO2 max. That's another reason why it's a great proxy. But it's the volume of oxygen you can process per minute per kilogram of body weight.
Right.
Okay. And so the reason that's so important, you're pushing yourself to the maximum. I'm on a stationary bicycle with a mask so they can measure my oxygen exchange through the mask, which was kind of annoying. I was making this gesture like, can I pull this off? Can I pull this off? And the doctor's going, not yet. We're still measuring after I'm done. I'm like, let me get this thing off. But you're measuring the gas exchange while I'm exerting myself steadily harder and harder until I get to that point that you described where I'm processing as much oxygen as possible. And it's still not enough to hold 360 watts for 5 hours like the Ironman guys. I did it for a minute, but it's a pretty mind-blowing thing. And improving that is literally reversing the aging process by any definitive measure, because you talk about the people that had your number was 47 when you were 55, whatever. There's no better measurement for that. It's not just fun and games like you go on the internet and get your age put in and see if it's younger. It's truly a high-functioning cardiovascular system that's showing protection against the disease patterns that are the major killers.
Yeah, and it's an amazing indicator for athletic prowess, right? So Vingegaard,
the Tour de France champion.
Yeah, if you look at the time trial, he beat Pogacar by 3%.
Yeah.
And Pogacar beat the field by 3%.
Yeah.
Right. But if you look, his VO2 max was 97.
Yeah. It's ridiculous.
So he can extract oxygen and match it with glucose and generate ATP at a rate that's just off the charts. So of course he's got an enormous advantage. It's almost like he's got an oxygen tank that he's got strapped to his back.
Yeah.
Compared to some of these other guys.
And this has been around exercise physiology for decades as a really important number for high-performing athletes, and they've tested all the great runners of old times. Steve Prefontaine had a high VO2 max, and Lance Armstrong and so forth. And it's really cool to see it now coming into mainstream medical science, where we want to look at someone whose VO2 max is 27, and we need to get it up into the healthy threshold. Forget about the 80 and 90 elite performers, but it is, in many ways, a genetic gift, but it's also highly trainable, especially if you're inferior. And, I should have lost some more weight. I shouldn't have eaten so much last week because I stepped on the scale and I was like, oh no, my VO2 max calculation is going to be. But you described that it's really important to correlate the VO2 max with lean body mass.
Yeah, if you really do it scientifically like that, like the super academic people would correlate it with the total lean muscle mass, like we talked about the Mark Bell people and the bodybuilders, like they have so much muscle mass that their VO2 max probably wouldn't be an adequate indication of
so nice, man. It would suck.
Yeah.
SEMA would suck. Mark Bell would suck.
Yeah.
But it does bring up an important point.
Which was like actually like skinny guys like you and I would actually have a way
to those guys.
Trust them.
Yeah. But then we look at all the attributes that represent total comprehensive functional fitness. And so VO2 max is a really nice, beautiful pie slice. But then we should also look at explosive strength and power and how badly I suck on pulling a deadlift bar off the ground or holding a squat bar. Mark Bell doing 1,000 pounds and running the Boston Marathon. Achievements like that are extraordinary. It's the age of the hybrid athlete, which is so fascinating to me to see these people that have these tremendously varied skills. And I think Vingegaard, he would probably get blown out of the super training gym. He probably couldn't lift up anything in there, but he's built for one thing, which is endurance in the mountains and time trialing.
Like a T-Rex.
Yeah,
arms.
That's right. Big legs. Those poor cyclists. Yeah. So it's nice to emphasize something like VO2 max and then put those other pieces in there that are also so health boosting. So
yeah, I mean, I'm not training professional athletes here. I'm training guys to live really good, healthy, long lives.
Yeah.
I mean, I do see some athletes, I do see some ex-athletes, but most of my patients are 40, 50, 60, 70-year-old that just want to stay in good physical condition, good sexual health, have their hormones, optimized, and want to live the best life they can.
Now, is there a psychological component where someone might come in here and look good on the ultrasound and have good vascular health, but still be complaining of, unsatisfying sexual function or something?
Yeah, I mean, there are anatomical issues, right? I had a 17-year-old kid with really bad erectile dysfunction, right? And he has what's called a venous leak. So as the arteries pump blood into the penis and fill the penis, it blocks the veins from returning blood back to the rest of the body, kind of like an ice cream sandwich squishing the ice cream.
Oh, right? And is that the ones that pass out? Is that one of the symptoms? I thought.
Well, I mean, my penis isn't that big.
If you hold enough blood leaves my brain,
you pass out.
We got to
take room 4. Then you're probably in my P-long protocol.
Yeah.
But so there are folks that have anatomical issues in the penis that make it more difficult for them to trap blood in the penis. And so, like I get to see those guys because those are the guys that have problems. If you're 17 and you get normal erections, you certainly don't come in to see me.
I'm asking, is there a psychological component to where someone is anatomically healthy?
Oh, yeah.
Coming into the clinic and saying, "Can you help me?" And it's really because,
psychological.
No.
So the half of it's physiology and half of it's psychology, right? So there's a sympathetic nervous system and a parasympathetic nervous system, right? So sympathetic nervous system is you are a caveman, right? And you're with your cave woman, and you're hanging out in the cave, and there's a saber-toothed tiger that's just pacing outside, waiting for you to come out to eat you, right? 2 days go by, 3 days go by, and your cave woman's like, dude, what the hell's wrong with you? Get out there and kill the saber-toothed tiger. Right? Another day goes by, and she's like, you are the biggest wuss. My previous cave boyfriend would have taken care of business. What the hell is wrong with you? Another day goes by, and finally you're like, I would rather take my chances with a saber-toothed tiger than spend one more minute in this cave, right? And so you charge out of the cave with a spear, and you're in full-on sympathetic nervous system overflow. You're just like in kill mode, right? There is no blood going to the penis, no blood going to the kidneys, no blood going to the intestines. Every ounce of blood, every drop of blood is going towards killing the saber-toothed tiger. So you kill the saber-toothed tiger, and then you drag the saber-toothed tiger back into the cave, you skin it, you got the saber-toothed tiger rug on the ground, you got the tiger on the spit and the fire, right? Now, you go from sympathetic mode to parasympathetic, right? Parasympathetic mode is relaxation. Blood goes to the intestines so you can digest food, goes to the kidneys so that you can produce waste, and then it goes to the penis so you can procreate, right? And then when you reach climax, what happens? Climax, that is sympathetic kicks in. And why? Because, humans are we're out of the evolutionary phase, but if you're a squirrel out there and you're having sex, you're standing still. And there are all sorts of hawks and other animals that are looking to take you out for dinner when you stand still. So as soon as you ejaculate, you get a sympathetic outflow, blood vessels contract, and you start looking around to protect yourself.
Oh,
right?
Okay.
And so if you have anxiety, if you have, stress-related issues, then you're going to have difficulty getting erections because you have adrenaline and cortisol floating around in the bloodstream, and that adrenaline and cortisol is going to work against erections.
So you have to chill out to get aroused. And then you're going to climax and kick into the other, the fight or flight momentarily, I suppose.
Right. But I mean, if you're in the moment and you're doing it and all of a sudden you think about work or you think, oh shit, did I leave did I lock the door or not? Or, last time things didn't go so well, you get adrenaline. And then guess what happens?
Instant.
The blood goes away.
So is it literally a function of blood flow when you're talking about this?
100% blood flow. There's a threshold, right? If you get enough blood pressure, then you lock the blood in because you block those veins.
Right.
So think about it this way. You're on the roof of a burning building and then there's another building 6 feet away. If you jump 6 feet, it's a good day. If you jump 5.5 feet, it's a really, really bad day, right? So if you get enough blood pressure to trap the blood in the penis, it's a good night. If you don't get enough blood pressure, and so you get a full penis, but you don't get a rigid erection, then it's not such a good night, right? And that's where Gainswave and PRP and Affirm and PDE5 inhibitors and all those other things come in, is to help raise the blood pressure inside the penis so that you can trap that blood.
And then the rest is up to you to maintain that calm, confident disposition, wind down from the stresses of the day and enjoy a chance for an encounter and so forth.
And work out.
Right.
Hydrate.
Bring your A game, people.
Keep your cholesterol low. Don't smoke. Don't drink. Stretch. Meditate. Get good sleep. I mean, all the things.
Be a 21st century man.
Yeah, be a 21st century man. And then, and keep your relationships in good shape. I mean,
right. If there's relationship dysfunction, clouding over all these matters.
And that, sometimes that's the hardest thing to do.
Sure. Yeah. Yeah. And it seems like, sexual intimacy is one of the first things to go with relationship dysfunction, which arguably it should be kind of the thing to stay strong and as a foundation.
The other chapter that in that book that's amazing is what men need to know about menopause. Right? So if you're a guy and your wife is hitting mid-50s and things are starting to get strange, you have to read that chapter. It's really, really well written. A friend of mine, Russ Bartels, is a really excellent gynecologist, also a guy around our age. And he does an amazing job describing what's happening to women in menopause. You have to, if you're a guy and your wife is going through menopause, you have to understand what's happening.
You have to care enough. Read that shit.
Yeah,
understand.
Yeah, not just care enough. It's like it directly impacts your spouse, but that directly impacts you.
So it would be nice for people in the area to come to your clinic. Failing that, they can get the book. And how else can we connect with you?
Yeah, so if you go to the 21stcenturyman.com, it's all written out in letters. You can get the book there. I have a bunch of chapters out there for free on the book. I also have my own personal medical practice website, brandeismd.com.
Videos on there.
Yeah, and then I have a YouTube channel. I have an Instagram. And then I have Affirm Science. So that's my supplement company. So we have a nitric oxide boosting supplement. We have a supplement for premature ejaculation called Prelong. That's a huge problem for men. 1/4 of men suffer from premature ejaculation.
Why is that? What's the cause of that?
the cause of that is that it's a good thing to ejaculate prematurely, right? So if you're a squirrel,
Back to the squirrel.
if you're back to the
And it's
squirrel,
funny because we're looking out the window. There's the squirrels.
um,
He's got a little squirrel now.
Yeah, I got
He's reflecting when he takes a pause from his writing chores. He looks out the window and sees squirrels screwing or
you
whatever.
can learn about squirrels a lot. If you're a squirrel, you want to do your business and get back to defending yourself, right? And so you're fighting a biologic propensity to ejaculate and protect yourself. And so that's why it's so difficult. You know, guys sort of have to train themselves to delay gratification. And so prelong is St. John's wort, or it's an extract of St. John's wort, which is a natural selective serotonin reuptake inhibitor. And SSRIs are known to delay ejaculatory function.
And what about on the flip side, like the inability to finish the job? Is that...
So that machine that you were on, the M-Cella?
Oh, we forgot to talk about that M-Cella. That was putting this room, that room, this thing, that thing. Okay, the M-Cella was zapping me between the legs.
So I did the original research to show that the M-Cella is the first and only treatment to improve ejaculatory function in women. We're actually writing that paper up now, but I presented it at the Sexual Medicine Society meeting. There's another medication called cabergoline that will help with ejaculatory function, but it's much better to do it with the M-Cella.
So that's a function of insufficient muscle.
Yeah, it's a weak bulbocavernosus and ischiocavernosus muscles. So like when you're trying to contract your pelvic floor and you feel that sort of pump, that's those muscles. And so it strengthens, like you experience, strengthens those muscles, like a Kegel exercise, but 20 times stronger.
Oh boy! Well, it's been great to connect with you and go through all the protocols here. I strongly recommend taking a trip to San Francisco Bay Area to see this clinic in person and experience all the value here. Same with the book. Dr. Judd Brandeis doing his thing.